Hello, everybody. Welcome to the Better Together podcast. I'm Mike Baker. And again, I'm so excited about our conversation today. I say that all the time because we just have exciting conversations here on this podcast. Thank you for being here. Thank you for joining us. Remember, follow the podcast, hit the like, leave some comments. We really love the engagement, so go ahead and do that. Today, I'm joined by Kelly Baker and Brendan Mandel. We're going to have a really great conversation about women's health today. We are going to talk about how the healthcare system for many, many years has, honestly, I think we've let women down across the system. You know, again, we run a primary care practice here at Heritage Health. We do the very best we can, but I think through the life experiences that I've experienced going through this with my family, and just really working inside the healthcare system, I think we can all agree that we can do things better. And so today's conversation, we're gonna talk about healthcare across the lifespan. I want to introduce our guest today. I'll start today with Kelly Baker. Kelly has a common last name, so that's good or bad. I don't know. I think it's good.
It's good.
But Kelly is a physical therapy assistant. She's also a Pilates instructor. And she has sort of gone through this women's health journey with our daughter Samantha, also with herself. And she'll have a chance to talk about kind of the things that she's dealt with. But Kelly brings a lot of life experience into this podcast, and I'm so excited for you guys to hear her story. And next here we have Brendan Mandel. Brendan has an incredible background, all just working in global health, looking at how do you solve complex problems. I think the part I've always loved the most about when you talk about your work is that last mile problem. You know, we can solve lots of problems, but if you can't get it to the end, to the person that needs the healthcare, all that work just doesn't make it there. And so Brendan has solved complex problems all across the world. Brendan has served on our board for many years, and she's now joined the team at Heritage Health, and she's running our women's health project. So this is going to be a powerful episode. I'm so excited about it. Thank you for being here today. Let's go ahead and just jump right into it. Kelly, when you think about women's health across the lifespan, talk about like the experience that you've seen over the last few years as we've got into this space. What are we missing inside the healthcare system when we think about women, you know, kind of all across the lifespan?
I think education, it's hard because we have a lot of doctors that have been super helpful but don't know how to fix different things or don't talk about those things further as though we don't have any questions and we should just know that ourselves. And I think that's a hard part, especially when we found out, like it took a long time for us to find out that Samantha had endometriosis. And it just happened because I happened to work at a physical therapist office that dealt with clients that had that disease. And but otherwise, I don't know if we would have ever figured that out. And I only found out because we had gone out with her or figured that out with her. And I was miserable in my own way for like 20 years, but everybody just thought, are you dealing with it? And I'm like, yeah. So I just thought that was how it was supposed to be. So not very fun that way. But even just as I'm going through like perimenopause and stuff, like the first thing that someone said was, oh, you might be going into menopause, but nothing else. I'm like, okay, so what does that mean? And I didn't realize how much it meant until like several years later. And I did my own education and realized there was a lot of things that were changing that I didn't realize like all was because of the perimenopause stuff. So
Yeah, no, I mean, it's been interesting to hear the stories and just see friends that we know open up as we have conversations, you know, based on that. Brendan, as you've been working, you know, across the globe and then, you know, working here locally, when we talk about this issue, what are some of the things that have, I don't know, sort of made you excited about sort of joining the team here at Heritage and helping us build out this project?
Yeah, I mean, I really think for me, for Heritage Health, it's such an opportunity for a primary care system to better serve women, because I think not just here, but in sub-Saharan Africa and elsewhere, oftentimes women's health is sort of reduced to the reproductive years of having babies. And, all the things before that and after that are often dismissed or assumed to be the same as men. And so what we know is there's been just a big gap in research about what is different about women. I mean, there's the obvious differences that we know in the reproductive system, but, through the lifespan, there are a lot of differences in, for example, women have smaller hearts and more narrow blood vessels. That means that cardiovascular disease is going to progress differently. So the same diagnoses and the same treatment that have been used for men don't necessarily work for women. That's kind of on the very physiological side. I think on the just societal side, the expectation that women just need to suck it up and just get through it. It's just part of being a woman. I think it's pretty dismissive and disheartening, and I think a reason why a lot of women don't engage with the health system until they absolutely have to. 25% women live 25% more of their life in poor health compared to men, and I think that has to do with gaps in research, but also just experiences with the health system. So I think primary care, because as women and men go through different phases of life, they may engage with specialists or need to have, separate or specialized treatment. But primary care really serves as kind of the umbrella to integrate and coordinate that care, right? A primary care provider has the kind of air traffic controller view of a person, and whereas a cardiologist or endocrinologist or a OB-GYN, they're specialized and experts in that particular area. But a primary care system can kind of see across the different needs that a woman has. So I'm excited. I've always felt like there's no reason, whether it's a 12-year-old girl in Kenya or a 50-year-old woman in North Idaho, there's no reason that women and girls should miss school or miss sports or dance recitals because of excruciating pain. There's no reason not to just fulfill their kind of physical and mental and emotional happiness.
Yeah, I mean, it is so sad to watch, and I'll bring Kelly in on this one here, but just from the lens of a dad and then the CEO of a healthcare organization, looking at the struggles that I've seen our daughter go through and Kelly go through, and then in turn all the other people that we've met, through these conversations and hearing the stories. I mean, it's powerful, and it's heartbreaking to see so many people that are suffering silently as we go through this. Kelly, talk a little bit about sort of just the experience of, sort of going through some of this stuff with yourself, but also as a mom watching your kid go through some of these health challenges, and how that relates as we've interacted with the healthcare system. We joke about breaking doctors oftentimes, so maybe you can kind of elaborate on that just a little bit.
As a mom, it's hard. Sammy's been dealing with it since her first menses, and that was probably 6 years ago. And now it's become a normal, which stinks as well, that we just know that she has one good week a month, and then other than that, she's pretty miserable and down the rest of the time. And so she takes advantage of that week, but it's really sad to think that 1 week a month is all that she has that's good. And, but yeah, we break doctors all the time. Everybody is okay, I think we've gotten to a point where I can't do anything more for you. So you're going to have to figure out where to go next. And that's been very hard as well, because with endometriosis comes many, many different things that are co-syndromes with it. And so that's it's been very difficult to figure out where to even go or who to even see about this. And then the specialists, we have to wait months and months before we can see them or have anything done. And so, yeah, that's a challenge.
It's a lot, right? And
Yeah.
I love how you were talking about sort of the primary care aspect of this, Brendan. I think this is the opportunity that we have in our community right now. This project here at Heritage Health is really working to build that primary care center where we can provide the training. So healthcare providers are great people. They care, they have big hearts, they're in this for the right reasons. A lot of times we've just found it's all about the training. It's all about the resources and keeping up with new information. We found that as we learned about the endometriosis stuff, we brought in some training to our primary care providers, and then all of a sudden, that's the first thing that's popping up in the algorithm in the provider's head as women are describing their symptoms, and they're believing women more, and they're sort of getting that process, getting through that process quicker to where we're getting to a diagnosis of endometriosis faster, which is great. And it just took additional training. And so I think that's such a big part of this. Brandon, as we're talking about the Center for Women's Health and this project we're working on at Heritage Health, the goal is to create that central hub where we have providers that have been trained, they have access to all the current information. You can take off your backpack and come in and relax and know that you're loved, you're trusted, we're here to support you, framing that out. As you see that, talk to us a little bit about that primary care center and how you see that interacting with specialists across the community and what the power of that hub, potentially could look like.
Yeah, well, I've spent the last couple weeks talking to a number of Heritage Health providers and then some specialists in the community, and I think it really does come a lot back to training. And depending on where a provider, and I'm not a clinician, just so everybody knows, but depending on when a provider, like a mid-level or an MD, was trained, they got different levels of exposure to women's health, and not just OB delivering babies, but adolescent health, contraception, menopause, perimenopause, cardiovascular, diabetes, and I think if you haven't been trained or if you haven't had practice in, doing a pap smear or placing an IUD, if you haven't been trained or had practice in that, it's not that they don't care or don't want to. It's a matter of kind of confidence and developing that. And so I think there is an interest in our providers to do more and do better, recognizing that, half the patient population are women who have different health needs. And we can do more in primary care so that our partnerships and referrals to specialists are better. They're smarter. We've done what we can in primary care with workups or labs or imaging or, counseling, and, can either keep women kind of in the primary care system, which is more time and cost efficient for everyone, or we can refer them to the specialist when needed, but have more information so that the labs have been ordered, the results are there. When they go to the OB-GYN, that specialist has more information from us. So I think the idea is to kind of deliver a more effective model, not just for Heritage Health and our patients, but actually for the whole healthcare community, by doing more within the primary care, behavioral health, perimenopause, menopause, chronic disease workups. And then when it gets outside of what we're capable of in the primary care, we do have the mechanism to refer and collaborate closely with specialists and still have that kind of bird's eye view and the ability to coordinate and integrate care for that patient. So what often happens is a woman will then, go to an OB-GYN, have her babies, and just stay there. And I'm guilty as charged because it's easier, right? I went to OB-GYN, had my babies, I'm done. I'm in perimenopause, menopause. I really don't need to be having an OB-GYN as my specialist or as my PCP. We need her to be, serving the OB-GYN needs of our community. And so every visit that I have with her is less time where she can safely deliver babies or do GYN surgery. So the idea is not to become specialists in women's health outside of the primary care scope, but to really do more within primary care so that our partnerships with the specialist community are more effective. And that helps the patients, it helps us, it helps the specialist partners.
Oh, I think it's been really cool to see the energy as we've had these conversations with people in our community, just elevating this conversation. I mean, people are excited about the potential that comes from sort of collaborating and uniting things under one roof. And we've talked, the goal isn't to make it so that you have to come to this one place, but use this hub as a place to learn, to build out better systems and process, better training, and then make sure that that spreads out to all the primary care, in our community. So like you should just be able to walk into primary care, have someone that believes you, has, up-to-date training, and understands the protocols for some very complex issues. Kelly, when you think about like the future of healthcare and what this looks like, what does it look like to go to a primary care setting and receive good care? What are some things that might have been missing in the experience in the past as far as like sort of the compassion, some of the things that we've experienced? If you could create like the perfect experience for women in your life, for yourself, what would that look like? You walk into a building, and what does it look and feel like?
I guess comfortable and knowing that there's going to be follow-up questions. I think with women, we've always had to, we're tough. We are like a lot of the things around our cycles, like, oh, they're hard and all the stuff. And it's just stuff that we have to deal with. And so when we go to the doctor, we don't play things up. And so if we're miserable, like we're really miserable because by the time you get to the doctor, like you've dealt with a lot by that time. And I just think that if we can be believed and then just having that knowledge there, like, okay, so this has been happening. What are you doing to, like, how are you really fixing it? Are you really okay, or what else is happening? I don't know. I think a lot of follow-up questions because a lot of us tend to downplay some, even once you get into the right doctor. So, like, it took me a long time, several weeks of knowing that I probably had endometriosis. But for me to make my appointment, and then I didn't want to go because I just didn't feel like I would be believed. And then, and I would be pushed off to someone who didn't know either. And that is not what I came across when I got into that appointment. And I was very much surprised at the care and concern and the different problems that I had had. Like more questions were asked, more details, and just a way that I was able to, they figured out what was going on, which was great. And I think even when I had to have a second surgery, I didn't believe that was the problem as well. I mean, Mike was the one who pushed me into that second appointment, and there was still problems there. I still had endo, and that was what was still causing me pain and stuff, but I didn't want to believe it. And I just thought, no, I'm fine. I'll deal with, I'm here to take care of Sammy. I don't want to deal with my stuff. And I think that's just how a lot of women are. Like, I had a conversation with someone recently, and she's like, I think I'm just resigned to never feel good again. And she's like 45, and it's very sad to have someone say that at that age, that they're just like, no, this hasn't helped. The doctor doesn't really want to help me, and it's sad. So
It is. I mean, it's heartbreaking, to be out and, again, just I'm not experiencing these physical symptoms, in my life, but watching the people in my life, going through them, like it's devastating. And, as someone, part of the system in the healthcare world, it's just like, it's this extra responsibility where like, we know we can do better. And, again, I want to frame it like we're all doing the very best we can with the knowledge and training and information that we have. Like you can come in and work on it, but this energy around collaborating more with our patients to learn more about what's actually happening. There's a whole retraining that the healthcare system needs just across the board. Brandon, you've talked a little bit about some of the research that's happened in the past, and just how, and Kelly's talked about this too, just how women have been left out of some of the studies, and the average that's created for a lot of the lab tests, it's based on 45 to 60-year-old men, and that becomes the average, the standard
Right.
for everything across the system. So, I mean, this is a global challenge that we have to work on, and thinking that we can, do anything about it in little old North Idaho, I think that's the most heritage health thing out there. It's like our board of directors set this standard that we're going to be the standard of life-changing care in the world. And, when that came from the board, from the board retreat, it was like, in the world? Like, cool, that's awesome, but we're a little North Idaho. But I think this is a really good example of, okay, we're going to tackle a really big problem and bring it together. Let's talk just for a minute about some of the sort of the research flaws, some of the things that have been out there, and then I want to wrap the episode up with a couple tips for anyone out there that's listening. What are some questions they should be asking, and how they can engage with this system, and I think we'll kind of go from there. Does that sound good?
Mm-hmm. Yeah. I mean, honestly, one of the most exciting things I think about the Women's Health Initiative at Heritage Health is, yes, we want to strengthen across the board all of our sites, but the Center for Women's Health really gives us an opportunity to be kind of community conveners, bring in specialists to, like you had mentioned, how can this be a very dynamic place with training and learning and a resource for providers in the area, a resource for patients and families. For a long time, women have not been, they've been objects of research, but not subjects of research, or the baselines have been established based on men of a certain age. And so we are learning more. I mean, there's, it's always subject to available funding and certain policies, but I think the younger generations of providers are going to have more cutting edge information. Even providers and specialists who've been practicing for 20 years, they should and probably will have access to new information emerging from research. So I think it's an exciting opportunity for our community. There's no reason why in Little North Idaho we shouldn't provide a standard or of excellence. It certainly doesn't need to be a Harvard or anywhere else. There's no reason why we shouldn't. So I think in partnership with the specialists in the community who are following research in their respective areas, and just having a center that is very dynamic where we get to kind of introduce the latest and greatest. I mean, I think about my mom, a generation older. I think, to your point, is just sort of, you just suck it up, right? I don't think she knew how to be an advocate. And so, when we have patients and providers walk into the Center for Women's Health, I think our vision is that it's a learning journey, and it's okay to ask questions. It's okay to not have all the answers. It's okay to advocate for yourself. It's okay to just say, like, something's not right, or I don't feel good. And hopefully we also, the providers get to be part of that relationship and partnership in that journey. So that's what I hope. But I mean, the research, it takes a long time to get to the bottom of answers, but there are exciting things happening in endometriosis at the NIH even right now. So I think if we can kind of keep our eyes open to what's happening in emerging research, that's a role that Heritage Health can play in the community. and to do so partnering with specialists who are also monitoring their area. But it's also interesting, the information age, because I think maybe our generation, we're just sort of like at the pivotal point of having access to information and being advocates and being consumers in our healthcare. So, I think we'll find an interesting balance of like, you're not going to get all your clinical answers on Reddit, or you're not going to necessarily get great clinical answers. And you may get some misleading information on TikTok and Instagram.
TikTok's
so
the source.
It will be a dance. And I think we, on the provider clinical side, are going to have to figure out how to communicate effectively in a way that women of all ages respond to. But I think, as long as we can kind of maintain our eye on the ball of being standard of quality care and sifting out noise on social media from actual, evidence-based good practice, good medicine, and good counseling, I think little old North Idaho can put us or ourselves on the map for women's health.
I just think that part of it is just so exciting. I look back to, our founder, Lidwin Durney, and, just the energy that she injected into this organization. We've done this multiple times in the history of the organization where we've taken on big topics and have really delivered on it. We're coming in at the tail end of Center for Healthy Living, where we're consolidating medical, dental, mental health, substance use treatment, physical fitness, nutrition, pharmacy, all of these things under one roof in an environment that cares about you. I mean, I look at that and say, I think that's what Lidwin had in mind when she said, never give up and, just build this system that makes sense. The Center for Women's Health is a little ways out. Mm-hmm. I mean, we're starting some different things this year. I mean, there will be incremental improvements before we move into a hub, right? But so for the women, for people that are listening to this episode, let's leave them with some practical advice, some tips to sort of be advocates for yourself. So Kelly, as you've interacted with the system, so I mean, you teach Pilates, there's this holistic approach to just taking care of yourself. What are some things that you have done recently with the information that you've learned to start to control your health a little bit better and, sort of put you on a little better trajectory on your own as you advocate for better care, within the healthcare system?
I've been just trying to read as much as I can about my life right now, I guess. So menopause, like that it's coming, and what to do and how to be stronger through it. And so that means, yes, doing exercise, like taking care of my body and trying to eat a little bit better, or just paying attention to what I need, giving myself grace when my body is not filling up for whatever is to come, and either saying no or not today, or just kind of paying attention to you, like, and all the stuff that's going on in your brain. So whether it's, just a good reminder for anybody who is in pain. I think of Samantha, like we pay attention to her, and she knows that she's not feeling up to it. That's a down day. So, but we love it when she has a good day. So, I don't know.
I like that. That's good. So I think some of the things that you and I have learned, just talking about it and building community out there. So, how would you encourage people to be open and talk about it more? Like, even with their husbands or their spouses or friends. I mean, I think as men, like, sort of, we have this perception that we think all these things are icky, and sure, like, it's a different conversation. We didn't necessarily grow up in this space, sort of learning all the vocabulary and everything that's happening, and society throws things on men as well about this space. But do you have any advice on, like, how to share the information and bring
I don't
other
know.
people in?
Yeah, I feel like since all of this has happened with Sammy, I we talk about things all the time that were probably taboo. And, she went to her 5th grade maturation, and the nurses are like, oh, just, you can secretly come to my office, and then we'll like tuck whatever you need into your pocket, and you can, and I'm like, it doesn't need to be a secret, guys. Like 50% of us do this. And it is what it is. Like, and it starts at this age and it ends around this age. And, I think just trying to talk about it to anybody who is willing, it really does open those conversations. And then you realize how many people are actually going through it as well and don't know what to do. And so just being able to be that support person for somebody else, maybe from my perspective, like with my knowledge that I have, I can help maybe guide people in a different direction if the thing that they're trying is not working. So, just talking about it. And I love that you go to the hockey room and talk about it with the people there. Like, that's not something that every guy does. So it's just something that you don't want to talk about.
Yeah, well, I think it's building community. And I think we learned these lessons back when sort of the mental health crisis was going on. I mean, we just learned that everybody is dealing with something. Like, as we go through life, the person sitting across the table from you, the person you see in the grocery line, like, everybody's dealing with something. And I think the more we continue to mask and cover it all up, the further we grow apart. But, when we open up and, we don't always have to talk about all the terrible things in our lives, but when you open up the door and say, here's what I'm struggling with, I mean, it allows people to enter, and I think you build community. As we've been having these conversations, Brennan, do you want to share anything about sort of conversations that you've had within your spaces and, how that's starting to change anything?
Yeah, I mean, I think my experience in global health is that, there's a lot of discussion or taboo or discomfort in talking about women's health, mainly the reproductive, cycles and systems and everything. But I think normalizing talking about that, and it goes for men too. I mean, I think it maybe is a different version, but men not talking openly about their physical or emotional or mental health, not engaging with, not seeking healthcare when they need to, not sharing with their provider everything they're feeling, right? There's, your provider can only help you as much as the information they have. And so I think it goes for men and women to talk openly and freely and to normalize that. Women are professionals, colleagues, students, caregivers, and we want them to feel, I want to feel good when I'm working. I want to feel good when I'm parenting. I want to feel good when I'm a partner to my husband. I want to feel good as a member of the community. I think men want the same thing. We all want the same thing for each other. But I think, often, it's like the women's stuff over there. And I mean, this dates back to like prehistoric times of like segregating women and their health things and like making it taboo or the red tent. And I think, the men that I know in my world and young men, they care. And, the more we like sideline them in the conversation is not normalizing the need to talk about it and address it. So I'm a big, and the most successful programs I've ever worked on in Africa and Latin America, the men have been champions, right? They've been allies, they've been champions, they've been part of the conversation, they've been part of the education, they've been part of the eye-opening experience. And women are half the population, men are the other half, give or take 0.5% or percent. So it really has to be collaborative. But I think, the basics that we are learning about longevity and health are movement every day, fresh air and sunlight, eating well, community and relationships. I think that's really important now in the kind of social media information age of just human interaction. Those, that doesn't help if you have a major chronic condition, but it does help. And I think those are the things that just be honest with yourself about how you're feeling, engage with the healthcare system, have a primary care provider who knows your story and can help coordinate care. And as you guys both said, kind of talk openly and honestly about these things. We don't need to like shroud them in secrecy.
No, I mean, I love that. I think, the more that we can build community and bring everybody together. I love that you talked about bringing men into the conversation and women. It's just like enough of the labels. Like, let's just bring humans together to solve problems and just be real with each other. I think, that's the best advice we can have to solve any problem. It's really easy to hate people, for who they voted for and all these other things. Like, there's just this chaos out there that's pulling us apart. But I love projects like this because they invite people in. It's like, come in, let's be real, let's solve problems, let's open doors. And it feels so good when you get to sit down and have like just human conversations about life. And then you start to feel this momentum building. And I think that's what I'm feeling with this project. As we wrap it up here, you all know me, I'm the optimist, right? But so when we think about the future, what's something that you hope that we can accomplish in the next 12 months? Like what's something that you hope we can accomplish, whether that's a conversation, whether that's a system or a process? What's something that you hope we can accomplish in the next year here at Heritage Health?
Well, I've got a big list, but I think to bring awareness to our Heritage Health community, providers, patients, about the importance of women's health, not at the expense of men's health, but just a kind of awareness that there are clinical differences that need to be addressed and incorporated, and training on certain women's health across the lifespan to make sure our providers feel empowered and confident and supported in delivering that care. I'd love to have the Center for Women's Health open with like soft lighting and plants and tea and a sense of like comfort the minute you walk in that you will be heard and listened to. So if wherever we are in the center opening, in the hub, I'm hoping that our providers and patients have kind of a mutual understanding of it's okay to talk about women's health, and we will come in and see us, and we will take care of you.
I love it. That gives me so much hope. Kelly, speak to the mom or the woman out there that's just feeling stuck. Give them some hope. What are a couple things that they could do just to have a little bit of hope about the future? She loves it when they put her on the spot.
Yeah, I know. I when I went through my physical therapist assistant training, the head of it, my brain's not working, sorry. He would always say, like, to get old does not mean that you're going to be miserable forever. Like, so when I work with my clients and they're having different aches and pains, like, either we figure out a way to work through them and they either go away. If they don't, then, we do try and figure out an answer, but I don't want people to think that just because they're aging, that you're miserable forever. And so it is finding someone who will listen to you and help you to figure that out. Whatever the cause is, it's not just because you turn 54. There's other things going on physiologically in your body that need to be taken care of. And yes, you have to step up and do some stuff on your own. But if it really is something bigger, like, I hope you can find someone who will listen to you and help you figure that out. So
That's great. Thank you so much. Thank you both for being here today. My hope for the future really is it's all of this. I think, if we can make incremental progress toward bringing people together, and that includes policymakers, that includes, community members, patients, providers. I mean, we need to make progress in opening our mouths and having conversations that might seem difficult at the time. They might seem polarizing at the time. But let's engage in the conversation and not live at the edges of all those conversations. I think, when we were working on this project, we intentionally decided to focus on primary care. It's really hard to disagree with anyone in this space that focusing on primary care for women, for men, for children, anyone out there, like if we can just take good care of our bodies, eat better, focus on our mental health, build community, understand the things that are happening, that there's so much power in that. And so for me, like my hope is that within, this year that we've made some real gains in bringing people together, and we start to see some change within the system. We already have seen change with our endometriosis training. We shrunk that diagnosis time from 8 to 10 years down to no time at all, because we understand it. And I think we can do things like that this year to train our providers to prepare for that hub that they're going to change lives. They're going to make this community stronger, and I think ultimately lead to a better community. And so I'm so excited about that. I can't wait to see all of that roll out. And, maybe in a year from now, we have this same conversation and we talk about, what we've accomplished and, what's still to come. But thank you for caring so much about the community. Cal, thanks for being such a great partner in life and just helping me see these things as we've gone through the healthcare system. I mean, it's helped me become a better leader and a better person. And, Brennan is you've been part of the board of directors. I mean, you've seen this organization through its ups and downs, and you've stayed constant. And then to just trust us enough to then take your career and be part of something, and that means the world to me. And I know it means the world to the organization that we're going to build something amazing. So thank you for taking the time to be here. And I just want to thank everybody that's listening. Thank you for being a part of this. I hope this conversation has opened your mind. And please engage with us. This is an invitation. We want you to be a part of this project. We don't have all the answers, but we know that if we can bring the right people together, we can build a solution that ultimately results in better days for people like my daughter, for people like your mom, your grandma, your friends out there. We know that we can do things better, and I'm just so excited for that. So thank you. I appreciate it, and hope you all have a wonderful week.
Oh, can I make a book?
Yeah.
Yeah. So, thank you for sharing your journey, and Mike, to you and the Heritage Health Board and staff for prioritizing this. I just want a real quick plug for a book called All in Her Head by Elizabeth Coleman. And it is a funny read, but it talks a lot about how early medicine and lack of research and just kind of the view and treatment of women's bodies has kind of led us to where we are today, but why it matters. And so it's a fun read. It's pretty light and amazing kind of historical context. But this is kind of a good explanation, I think, of why what we're doing is important. So
that's great.
Thank you.
So, and maybe we need to work on a good book club for all the great books. 'Cause, I mean, Kelly's mentioned all the books that she's read, and I love that the information is getting out to patients. I mean, at the end of the day, we have to fight for ourselves. We have to advocate for ourselves, and having that information is really helpful. So let's go check out the book, and have a great week.
Thank you.
Thanks.